So yeah, I'm Beth. I'm a second year PhD student at the University of Warwick in the UK. And I'm funded by Birmingham Women's and Children's NHS Trust. So today I'm going to just talk briefly about my planned PhD project. And part of that involves evaluating a complex intervention. So a little bit about me. I started my university journey by studying psychology, and then I went on to train in mental health nursing and CBT therapy. And then I worked in community and inpatient child and adolescent NHS mental health services. And I'll refer to those as CAMS from now on, just because it's a bit of a mouthful. So I've always been really interested in research, and as mental health professionals and clinicians, why we do what we're doing. And so I was lucky enough to be linked in with my now PhD supervisor, who helped me to get involved in some research whilst I was still working clinically. And then he let me know when this PhD opportunity came up. And that's something that I'm really passionate about, is kind of the opportunities for nursing staff to be involved in research. And it's something that I'd like to kind of help facilitate later in my career. And I also hope that I can go on after the PhD to be involved in both clinical and academic work. So my PhD project is funded by an NHS trust, like I said, and that funding is based on the PhD providing an evaluation of a new intervention for children and young people in the West Midlands. But my project will also be made up of two other parts, one of which will be a qualitative piece of work that will aim to explore the experiences of children and young people that are admitted into psychiatric hospital from residential care placements, and also a systematic literature review of systemic approaches in child and adolescent mental health care for young people presenting with risk. But today I'm going to focus on talking about the evaluation piece of work. So the service that I'll be evaluating is called IROC, and that stands for Intensive Residential Outreach Care. And I'll explain a little bit about the kind of background to its inception. So in the UK, there have been calls to reform CAMS services, and part of that has come about from young people experiencing really long waiting lists for support, a lack of integrated and coordinated care for young people, and high levels of dissatisfaction being reported by young people themselves and also their families and carers. So in England, between December 2019 and April of 2021, there was a 47% increase in new emergency referrals into CAMS crisis care teams. And they think that part of the reason for that might be due to the pandemic, but nevertheless, there are still these increasing rates of people reaching that point of needing crisis intervention. And I suppose as the waiting times for mental health support increase, it's kind of unsurprising that more young people are getting to the point where they present in crisis. And the current demands on our community mental health services mean that whilst hospitalisation rates for most paediatric physical health conditions are decreasing as we improve our community care, the number of admissions to child and adolescent inpatient mental health hospitals are actually increasing. And mental health inpatient admissions can be absolutely necessary to keep a young person safe and provide that really intensive support for children and young people. But it is widely recognised and kind of accepted that safely avoiding a hospital admission is preferable. So concerns have been raised about the impact of young people witnessing or being involved in restrictive practices whilst they're in hospital, the use of the Mental Health Act, reliance on medication, and how those can impact kind of long-term sustainable well-being for children and young people that are admitted into hospital. So IROC was also set up based on principles of trauma-informed care. And as we know, there's a well-established link between trauma and poorer mental health. And there's an increased likelihood for those that have experienced trauma to need hospital treatment. And we also see higher rates of mental health difficulties and childhood adversity for young people that are in residential care placements, which was where IROC's initial focus was. And despite these well-established links and the research that exists, mental health interventions often still focus on kind of changing the young person's behaviour, rather than seeing that as a reasonable response to really difficult traumatic life experiences. And so IROC wanted to work systemically rather than directly with the young person to support them to kind of reach well-being. It was set up as a service for vulnerable young people presenting with complex psychological needs who are more likely to be referred in for an inpatient admission. So like I said, it's a new and developing service, and it has evolved to meet the needs of kind of the wider mental health services in the area and also the people that it's supporting. So like I said, when it first was devised, it was focused on providing support to young people that were living in residential care homes. But that criteria has now been widened out to all young people in the area for who they're considering an inpatient admission, or for who they've put a referral in for a hospital bed. So for these young people on IROC's caseload, they provide a systemic approach. So they're working with the network around the young person rather than directly with the young person themselves. And that network may include residential care staff, foster carers, family members, social care staff, mental health professionals, and other agencies as well, and trying to bring all of those people together. So they provide a psychologically and trauma-informed approach, and that includes assessment, formulation, supervision, and psychoeducation primarily. And the kind of underpinning aims of their work is to secure, stabilize, support, and sustain the young person and their network. And they hope that the work that they do will help to build the right clinical treatment pathways for the young person, but also reduce staff burnout and anxiety within the system, so that that network can then help to safely avoid hospital admissions, manage risk and crises, and also reduce the number of placement breakdowns. So the IROC team themselves already have some evaluation pieces underway, and their kind of in-house evaluation aims to address some of their key performance indicators. So I'll put up this slide briefly. I know it will be difficult to see, but it's just mainly to highlight kind of the nature of the complexity of the intervention, with the number of different activities that are going on and how many outputs and outcomes are associated with those, and kind of what we were faced with when trying to plan an evaluation that captures all of that effectively. So that brings me on to some of the challenges faced in planning an evaluation of a piece like this. And I suppose one of the main things has been that IROC was commissioned as a time-limited pilot. And so there's then been some time pressures for them to prove their worth. And so that's why a lot of those in-house evaluation KPI measures have had to happen relatively quickly, which maybe are on a slightly different timeline to a PhD project. I think also as well, the fact that it is such a complex intervention with so many different parts to it, those have changed and developed based on the demands of the wider mental health services in the area, but also in terms of changing staff groups and skill sets. So that has at times made it quite difficult to focus in on a specific evaluation area, and also has proved some challenges when trying to ground the concept in an evidence base. Because like when I was mentioning earlier, the trauma-informed care and kind of really delving into the experiences of young people in residential care homes, and then that slightly shifting when the service specifications have changed. And I think that maybe is something that I hadn't considered about the nature of trying to evaluate a developing service. The other challenge has been that the research about alternatives to hospital admissions and service transformations in the area call for high quality, thorough evaluations so that we can develop a gold standard of evidence-based care for these vulnerable young people. But I've found that often those kind of calls for that evaluation still have a focus on really high numbers of participants, or asking for randomized control trials, which really isn't possible when a lot of this service innovation is happening within small local teams. And the part of the project that I'm at the moment is applying for ethical approval. And that has definitely presented with some challenges, mainly really to do with other parts of the project, but also making sure that we're seeking the right approvals for the different parts of my PhD project. And I think one of the main things that stood out to me during this part of the process is how in the NHS, the ethical approvals are, and the forms that you need to fill in and the processes that you need to go through are the same, whether or not you're doing a qualitative piece of work or you're conducting a large scale medication trial. So yeah, that's been quite a lot to get to grips with. But I think we're kind of towards the end of that part of this process. So faced with those challenges that I mentioned, me and my supervision team have proposed a case study design approach to evaluating IROC. So I really hope that using this will let me look at what's working for who and in what context as well. So the plan is to collect data for between 3 to 5 different cases in different contexts. So those contexts may be a young person that's living in a residential care home, a young person living with foster carers or with family, and then maybe across different geographical areas. And a case will be defined as all of those involved in the network around a young person that's accepted onto IROC's caseload. And so I won't be looking to collect data from the young person themselves. Because it's a systemic approach, I really want to primarily explore how it's impacting the network around the young person. And also due to the nature of the work that they do, sometimes the young person isn't aware that IROC is involved in their care. So I will collect data by conducting individual interviews, focus groups, and also observations of key IROC processes. So their assessment process, their formulation, care planning and coaching as well. And then I'll plan to analyse the data for each case individually before comparing them. And I hope that this data can then contribute to developing case mechanism outcomes that will help to provide explanations of some of the experiences and outcomes associated with IROC support, but also whilst considering the context that shapes those experiences. So finally, just some of my hopes and goals. So I hope that using this approach provides an answer to some of the challenges associated with planning an evaluation for something like this, or a complex intervention, and also will provide a useful exploration of how IROC is being received on the ground and what's working for who. And then I hope that this can be used to make sure that the service is meeting the needs of this vulnerable population, and to share learning with other interventions in this field as well. I'm also looking forward personally to developing my skills in these research methods, as it's not something that I've done before, and hopefully to highlight how this approach might be useful in terms of evaluating other complex health interventions. I'm currently doing a master's module in this methodology. And it's interesting because I think I'm the only person in the room that I've met so far that's doing anything that's health related. And it seems to be more popular to use this type of evaluation approach in kind of business models or economics. So yeah, it will be interesting to see and hopefully meet other people that are doing things like this. And yeah, that's it from me. So thank you for listening, and any questions.